Good morning, everyone. This is Shanka and Andrea with the Shank Show this Thursday, and we will talk a little bit about storytelling. Andrea, how important is storytelling for you as someone who constantly needs to explain how healthcare and understanding healthcare in the United States it was really pivotal for your career?
Yeah, I absolutely agree. I think storytelling is something that is severely overlooked. I think about doctors and how they're super analytical in the way that they think. They're scientists. So, what may be appealing to them is not necessarily going to be appealing to the patient. So, by that, I mean, if you imagine there's a patient that comes into your office, they're overweight, they've got all kinds of risks for chronic disease, or maybe they've had some complaints and they're coming to you. Are you going to hand them a brochure and tell them all the ways that tells them all the ways to avoid prediabetes? Or are you going to tell them a story about a patient that you saw that got better over time because they started to exercise more and eat healthy, and they were no longer embarrassed to take their grandson to school to go swimming? They could suddenly start doing all of these things. I mean, we know that stories are powerful, and then you want to know more. Well, what did they do? How long did they come? And you see glimmers of hope and things like that. So, um, that wasn't at all the answer to your question, but this is what I was thinking in my mind when I think about storytelling and I think about doctors. And we kind of miss the mark a little bit because they're so concerned about not, um, veering away from just data, data, data. But it's really the combination of both.
Hmm.
People.
Yeah, and I personally think we need to get away in healthcare growth and healthcare marketing from the boring, quite frankly, boring, sterile stuff. Physicians have the tendency to think that what applies in the operating room also applies on their social platforms.
Oh,
And
absolutely.
that gets them in trouble because in the operating room, they are the only ones who understand the terminology. And well, not the only ones, they and the staff around them, medically trained people. And then what they will often do is online, if they speak online at all, they'll use a bunch of jargon that confuses people. That, by the way, is a problem that a lot of experts have, is they're so close to the topic at hand, to their expertise, that they just cannot speak in simple terms about what it is that they do. And we are experts in helping craft a story that is understandable to the layperson, and that also evokes a certain amount of emotion. Andrea, do you have an example you want to briefly go over?
Sure. Bring
What
it
do you,
up.
bring it up. What are you going to tell us about? What are we looking at here?
Yeah, I want to talk about a case study with one of our clients with Direct Med Clinic.
Mm-hmm.
So they did a case study about a mid-sized San Antonio employer, and they talked about the challenges, the outcomes, and all of that. But one thing that really stands out to me is how we're able to incorporate these graphics that tell a story. It's supposed to visually represent something. And I think that by showing the average encounters per patient, so in this model of healthcare, which is called direct primary care, they are known for spending more time with their patients, but you have data that backs it up in the form of a graphic, which is a little bitty tiny story. So you have the national average, which is 1.6. So 1.6, um, then you have, well, that's how many times they come and see their doctor at all in a year. And then you've got the member's employee who is seeing them already more than double the national average. And then those with chronic diseases, which we know are going to have to go and see the doctor even more often, are seeing them over 5 times.
Mm-hmm.
So that, knowing that, number one, they're seeing them more frequently, and number two, they're spending more time with them, the national average being 13. And I really want to challenge that 10 minutes on Oh, I'm sorry. That's 30 minutes. Yeah, I knew that couldn't be right. I was reading too far away from the screen. 30 minutes, which makes sense because how can you have time to get the patient history or figure out what's going on with their complaints and then ask them what they've been trying to do to solve it and then prescribe them everything and explain to them how to use it and tell them it's like in 13 minutes you can barely sit down and take off all of your clothes, get into your the whatever the gown they want to put in. It just doesn't make any sense. So doubling that time allows them to get a better picture while still keeping them in the work. I'm sorry, while still keeping it at a reasonable amount of time where they can, if they're an employee, go back to work. So I think that, yeah, we showed a lot in just that little bit, each
Hmm.
story. And you can do that verbally as well. You can't get away from telling your story because you're, afraid of being in front of the camera. It's super important.
Yeah, and this is something that we will help with, because here's what we do for a client like this one. We like craft all this collateral. But if you are a healthcare provider or a healthcare professional and you want to be a little bit more active yourself on social media, but you don't really know what to say and how to say it, we are there to help you. We want to do this with you. We want to teach you the skills so that in a little bit more than 15 minutes per day, you can truly build up some serious online influence. And that happens in a online class that we have. And if you go to shanks.healthcare, it's blended in the ticker, then you can find more information around that. Um, how uh, how important is it, Andrea, to understand a certain rhythm and structure in a story that basically takes people through a curve of emotions?
No one wants to hear a boring, dry story or a story that has no problem, no plot, no climax, no apex. There's got to be a good story, and a good story always solves a problem.
Mm-hmm.
So I think when you can nail that down, and hopefully you'll understand that people want to hear that. They don't just only want to hear like the great outcomes, they want to know the challenges. And that's why, for example, in a case study, you do present those problems, those challenges. You talk about how you overcame them. And guess what? Everybody gets that rush of dopamine. And
Mm.
you people want to come back.
Yeah, and of course, the case study on paper is a whole different thing than you being on camera.
That's true.
A lot of physicians and a lot of healthcare experts, they are a little bit afraid of talking too much about clinical stuff and about revealing too much PHI. But there are so many metaphors and analogies that you can use to tell a story that the layman can relate to, and then towards the end you tie it into something that you want to offer, a service, a product, or maybe you're promoting an idea. We at Shanks, we can help. We help not only clinicians, we also help those who are maybe active in the academic field or the scientific field, or who have entrepreneurial aspirations to apply their knowledge, their understanding of medicine, and apply that to a business of some sort. All right. Well, I'll ask you to check out shanks.healthcare. And Andrea, any final thoughts before we release our dear visitors?
I love hearing your stories. I love hearing your FBI cop stories and the lives that you changed. I think you should talk about them a lot more. And it's
Ah, that's a
super
good point.
interesting because there is that connection between, seeing someone addicted and then helping them go through recovery, but in a different way,
Mm-hmm.
and working with doctors. And I don't know, I love it. I love so much your stories.
Yeah, I think there's something there that I can improve. We learn every day as communicators, and we'll weave that in a little bit in the future. And the same goes for you. I mean, you're well-traveled polyglot, and you have really public health and personal health has always been part of your journey. So anyway, great topic today. Have a wonderful day, everyone, and we'll see you again tomorrow on the Shank Show. Bye bye.
Bye.